Hi, everyone. Thank you all for attending. My name is Jamie Eimlin. I am the Associate Director of Graduate Admissions here at Penn Nursing. A few housekeeping tips before we get started. I ask that you please stay muted during the presentation, and to save your questions for the end of the presentation, we'll be using the chat box feature for questions at the end. A recording of this presentation will be emailed to you in a few days. And if I don't get to your question, or if you have something specific or additional questions, you can always email admissions@nursing.upenn.edu. All right, let's get started. We have a lot to talk about today. I am going to do a brief overview of our graduate programs, so our MSN, DNP, and PhD programs. We will not be discussing the accelerated BSN programs or our postgraduate APRN programs. We do have webinars and information on those. So if you want to email us, we can send you some more information, but we won't be talking about that today. I'll go over the application requirements and some tips for applying, briefly cover student services and financial aid information, and then we'll have our Q&A. First up is our MSN programs. And here is our list of MSN programs. Our nurse practitioner or advanced practice programs are at the MSN level. As you can see, our programs vary from primary care, acute care, across the lifespan. Upon completion of these programs, you'll be eligible to sit for the national certification exam. You can practice in any state with these programs, but please note that the state you might live in or practice in may have additional requirements beyond that national certification exam. We also have 2 non-clinical administration programs. Our programs can be completed on a full-time or part-time basis. Full-time is anywhere from 1 to 1.5 years. Our family NP and the nurse midwifery programs are the longest at about 1.5 years. The others are around 12 to 14 months. Part-time is usually completed within 2 to 3 years. All of our MSN programs are on campus, and we're located in Philadelphia, Pennsylvania. The clinical placements are organized by the school, and they take place in Pennsylvania, New Jersey, and Delaware. And as I said before, upon graduation, you're eligible to sit for your program's national certification exam. You might be deciding between a few programs. To hopefully help you decide, our programs are based on the APRN consensus model, which states that the focus of care is based on patient needs, not on the clinical setting. So if you want to become a pediatric primary care nurse practitioner, you can only work with pediatric patients in the primary care setting. This doesn't mean you can or cannot work in a hospital, but for example, you couldn't work in an ICU as a pediatric primary care nurse practitioner. So there's more information on the website about how this model works, but hopefully this might help you steer you in direction if you're deciding between population or acuity level. This is a very basic outline of our clinical MSN curriculum. If you go on the academic section of our website, you can see each program's curriculum written out. Each program starts with the 3 Ps, or our core curriculum: advanced pathophysiology, pharmacology, and physical assessment. Each MSN program is required to take a research course, which is a great way to get some introductory research in. Everyone their finished product at the end of the research course is something that can be published. So if you're interested in research, this is a great launching pad for that. You take your theory courses in your population, and then you complete your clinical placements. And for our administration MSN programs, this is what the curriculum looks like. Our health leadership program, the curriculum is a little more flexible. There are more electives. You can also take classes outside of Penn nursing, which is a great option to explore other nursing schools. Many of our students wind up doing a dual degree with the Master in Public Health program or the Master in Law program. They find that that goes really nicely with the health leadership program. The Nursing and Healthcare Administration program. The program is a little less flexible. There are some more requirements. There's also an administrative practicum, which is about 260 hours of work at an organization where you work with an administration leader. And again, that's a really great launching point for a potential career. A lot of students wind up finding connections and careers from their practicum. You can also minor in a variety of areas in the MSN programs. Do keep in mind that some programs only have one elective, some don't have any electives. So you might need to kind of finagle your curriculum a little. Minors are typically easier to do with part-time programs because you can spread it over the course, but it could add extra time to your program. With that said, we have a variety of minors. Most are only 2 to 3 courses. Some are just designed to increase your knowledge of a certain area. Others, such as the adult oncology minor and the palliative care minor, can lead to certification. So upon completion of those minors, you can sit for the national certification in that area. The minors with the asterisks can be completed as a standalone postgraduate certificate. So let's say you get your MSN, hopefully at Penn, but maybe you get it somewhere else. You decide later on that you want to be certified in adult oncology or nutrition or palliative care. You can come back and complete the program as a certificate. As I mentioned, all of our MSN programs can be completed on a full-time or part-time basis. Part-time can start in any semester. So you can start in the spring, which is mid-January, summer, which starts in late May, or fall, which starts in late August or early September. Full-time start dates depend on the program you're applying to. They either start in the summer or the fall. There's no spring start dates. So again, just keep in mind when you are applying, if you're applying for full-time, what semester that would start in. Our acute care programs require work experience. I realize there's a lot of text on this page. This is all on our website as well. For each program, you need at least 1 year of full-time RN experience in that population and acuity level. The neonatal program requires at least 2 years of full-time RN experience in a level 3 NICU or higher. All work experience should be completed full-time, calculated after orientation, and some orientations can last 3 to 4 months, so it needs to be a year after that, and be within the last 3 to 5 years. If you're not entirely sure if your work experience counts, you can always send us your resume and we will let you know. Our primary care programs do not require work experience, but our most competitive applicants typically have at least a year of RN experience at time of application. And for all of our incoming MSN students, they had an average of 3.5 years of work experience. So again, just to reiterate, because inevitably I always get questions about what programs do and do not require work experience. So the programs on the left are our acute care programs. They do require work experience. On the right are the primary care and administration programs that do not require work experience, but it is strongly preferred. We also have a non-degree option that might be of interest to our local students or prospective students. You can complete up to 2 non-clinical master's courses as a non-matriculated student. Most people wind up taking pathophysiology and pharmacology. It's a simple application. The deadlines follow the MSN application cycle, which I'll get to at the end of this presentation. So if maybe your academic record isn't very strong, maybe you're not quite sure what program you're interested in, but you know you want to do an MSN program, this is a great option, and these courses will transfer in as long as you get the minimum grade to your MSN program if you do wind up applying and being admitted to Penn Nursing. Next, I will go over our DNP programs. First is our DNP in nurse anesthesia. This is a 3-year program only offered on a full-time basis. It's also only offered on campus here in Philadelphia. You only need your BSN. You don't need an advanced degree to apply to the program. We are currently admitting about 2 years in advance. So applicants who apply this year are applying for summer 2023. This is not a typo. 2022 is closed. We are no longer accepting applications for that. The next cycle we're accepting for is summer 2023. There is a work experience requirement for this program. You need to have a minimum of 2 years full-time RN experience post-orientation, working in an ICU or critical care with the most critically ill patients. And we do not accept self-referral areas, which are on the screen. Even though it's a minimum of 2 years, our most competitive applicants typically have 2 to 3 years at time of application. The curriculum is fully integrated between your didactic courses, simulations, and clinical experiences. So a lot of programs will front load the first part with just your courses and your simulation labs. And then the end of your program is your clinicals, not here. The program starts in May, and by August, you're in your first clinical. So we really just get you right in from the beginning. We find that's the best way to just immediately immerse yourself into clinicals. We operate on a primary site model. So you are assigned a primary site where you will return to every year or every semester after you complete your other required clinicals and your specialty rotations. So it's great. You have sort of this mentorship with your clinical instructors. You have a home base to return to. And many of our students have a really positive experience with their primary site and wind up getting a job after graduation. Our other 2 DNP programs are the Postmaster's DNP and Executive Leadership DNP. Both of these programs are 2 years part-time and 100% online. There are a few on-campus intensives. Orientation, which happens at the end of August, is on campus, and then there's some other intensives sprinkled throughout the year. Most of the courses are asynchronous, which means you don't need to log in at a certain time to listen to the courses. The Postmaster's DNP is designed to expand the skills of master's prepared nurses to translate evidence to improve clinical practice and the health outcomes of specific populations. So an MSN or a master's degree in nursing is required. It does not have to be a clinical MSN. It could be in administration or education or leadership, but it does need to be an MSN or master's degree in nursing. There's no specific work experience requirement, but we do like to see around 3 to 5 years of post-MSN work experience. The Executive Leadership DNP is designed to provide master's prepared nurses who already have leadership experience with executive level skills to lead systems and organizational change. And this has an interdisciplinary curriculum. So as part of this program, you participate in the Wharton Nursing Leaders Executive Education Program, and you do take classes through Wharton and through the School of Medicine as well. This requires an MSN or a master's degree in a related field. So you do not need an MSN, but you do need a master's degree and at least 2 years of leadership and fiscal management experience, but we prefer 5 or more years. If you're not quite sure if you have the leadership or fiscal management experience, you can email us your resume and we'll let you know. We're not very prescriptive on the leadership and fiscal management experience because we want to encourage and allow diverse experiences into the program. So there's not a specific type of leadership or fiscal management experience that we're looking for. This is the sample plan of study for the Postmaster's D&P program. And again, this is online. And this is the sample plan of study for the Executive Leadership Program. And the courses in red are what differs between the Postmaster's D&P and Executive Leadership D&P. And again, this is also online. And last but not least, we have our PhD program. The goals of the PhD are to develop as a scholar and a scientist. So we are really looking for people who have an interest in a demonstrated interest in research. You do not need to have research experience. It is preferred, but it is not required. But we want to see that you have a demonstrated interest in some sort of nursing research phenomenon. One of the driving factors of our admissions decision is fit with faculty. So you are encouraged to reach out to faculty who align with your research interests and may be a good mentor. We understand that your interests may change, your mentors may change, but we do want you reaching out to faculty. Now is a great time to start. On our website, you can go to the research page and search by interest. And start reaching out to faculty if you're interested in applying this year. Our full-time students are fully funded for the first 4 years, which includes a living stipend and covers tuition, fees, and health insurance. And the program is on campus in Philadelphia, and you only need a BSN to apply. You don't need an advanced degree. The curriculum includes 7 core courses, including a statistical sequence. You can take the statistical sequence outside of the School of Nursing. So you might be interested in the stats classes at the School of Social Policy or Wharton. So again, another great option to explore other schools and interests. Depending on your funding, you're either coming in funded through a research center, which means you'll be conducting secondary research through that center, or you'll come in on school funding, which means you'll have a teaching residency or TA position. The median time to degree is a little under 4 years. So most people complete it in 4, but again, that depends entirely on your dissertation and your research. I want to very briefly talk about the Penn Advantage. I could spend a lot of time on this slide, but I've condensed it to 4 points to highlight. First is our community focus. There is a strong community within the School of Nursing. There are a lot of organizations to get involved with. Even for our grad students, there are different organizations within Penn Nursing and within the University of Pennsylvania. There's also a strong community focus outside of Penn Nursing within the Philadelphia community. We try and focus clinicals when we can on the community and on those who need, the most medical assistance, those who are maybe traditionally looked over for healthcare. So we really try and get you into community clinics and working with the community regardless of the program you're enrolled in. We also put on events for the community. So for example, the past few years, the Center for Global Women's Health started West Philadelphia Women's Health Day, where faculty and students and staff all volunteered to provide health services and education for residents of West Philadelphia. There are national and international opportunities. Those have been on pause the last year and a half. Hopefully they will return very soon. But students have been able to complete in some programs clinicals at different hospitals in the United States, travel around the country and the world for poster presentations and conferences. We offer short-term study abroad options, usually over your spring break or winter break. And there are also some international clinical opportunities. So again, as you can imagine, those have been on pause, but hopefully they'll be returning within the next year. As I mentioned, there are a lot of research opportunities. Even if you're not in a doctoral program, students can get involved with faculty and of course the surrounding hospitals to complete research, which again is just a great way to get involved. And maybe you're not interested in doing a PhD or DNP, but you are interested in research. This is a great way to get involved. And lastly, we stress leadership throughout the curriculum. We are not just training you to be a nurse practitioner or CRNA or PhD. We're training you to be a leader throughout the community, leader in your health system or organization. So for example, there are a lot of leadership initiatives at the school. We're very politically focused. So every year we will go to Harrisburg, the capital of Pennsylvania, on Lobby Day and lobby if there are specific laws or bills that might affect nurses, patients, nurse practitioners. So again, really encouraging you to be a leader in all aspects, not just in your career. Okay, application requirements and tips. These are the application requirements for our program, and I'll go over these throughout the next few slides. So in general, what do we look for? We have a holistic admissions process, which means as long as you meet the minimum for our different programs, and as long as you have a completed application, you are reviewed the same as every applicant. While individual aspects of your application are important, we are looking for strong academics, we're looking for well-written essays, we're looking for supportive recommendations. No one part of your application is more important than the other. So as I said, while we look for strong academics, maybe you didn't have a strong first semester in college. It happens to everyone. Or maybe you majored in something other than nursing and it wasn't your passion. And then now nursing is your second degree and you did really well in your nursing degree. So we're looking for improved academics. Maybe you are, you don't have a lot of work experience, but your recommendations speak really well to your passion about nursing, and you've had a lot of volunteer experience in the healthcare field. That can help with your application. So we're trying to read in between the lines, looking at all parts of your application, and taking the same amount of effort to review every single application that we receive. I encourage you to start your application early. Our graduate applications are now open. Starting early allows you the most time to submit a competitive application. It's also easier to fix your errors. You don't have to submit your application now. The deadline isn't for another few months. But just start the application, see what the requirements are. There's a lot of questions. You don't want to save that until the last minute. We require a resume for every program. There's no specific format required for your resume. Most people submit between a 1 to 2 page resume. The only time we've really seen longer resumes is if you have significant research experience or presentations, speaking engagements, that sort of thing. But most people submit between a 1 or 2 page resume. This is not an exhaustive list, but you can include a lot of these things on your resume. We like to see all professional experience. And if nursing is your second career, you can feel free to include any relevant experience before your nursing career, volunteer experience, extracurricular activities, honors, awards, leadership experience, if you've shadowed, done research, if you've been a clinical instructor, preceptor, significant hobbies. This is one way. If you feel you can't incorporate something into your personal statement or other essays, you can include this in your resume. Each program requires essays. This is basic information. I know this might sound silly, but you'd be surprised how many people skip this part. You want to make sure it's easy to read, double spaced and 12-point font. Again, you won't be denied if it's not that, but goes a long way when your application is easy to read. You want to make sure that you proofread. No one's first draft is perfect. And while one spelling mistake won't send you to the deny bin, the harder your application is to read, or the harder your essay is to read, the harder it is for us to evaluate. You want to remove any track changes because those show up if you upload a document with track changes. And you also want to preview your document once you've uploaded it, because whatever you see on your screen is what we see on our screen. In terms of content, there are many different nursing programs. We want to know, why are you applying to this program and why are you applying to Penn Nursing? What interests you about the role or the program you're applying to? For our clinical programs, what interests you about the population and the acuity level you are applying to? How have your experiences, this can be personal, this can be professional, how have they prepared you for this program and role? If you're applying to our PhD, Postmaster's DNP, or Executive Leadership DNP, we want to see a demonstrated understanding of your research interest or DNP project interest. You don't have to have this specific outline. You don't have to have all the steps written down. That's the whole point of doing the PhD or DNP program, but we do want to see a demonstrated interest. Our nurse anesthesia program does require a DNP project, but you do not need to discuss this in your admissions essay. And we also want to know about your career goals and your aspirations. Again, you don't need to list out your 5-year plan. We're not looking for that. But again, we want to see that you've really thought about this program and this eventual career. The best essays are not often from, the most experienced nurses or the ones, with the strongest academics. We get plenty of people with 4.0 GPAs who don't write a good essay. We really want to see your passions come through in your essay. We require 3 letters of recommendation. You can submit up to 5. You don't get extra points for submitting up more than 3. This is just for you if you're deciding between that 3rd and 4th recommendation. Now you don't have to. We like to see at least 1 academic reference. We understand the farther you are from any sort of undergraduate degree or graduate degree, you may not have a strong academic reference, and that's fine. But if you've been out of school 5-10 years and you still keep in touch with a faculty member or advisor, that's also perfectly fine to include them. We want to see a recommendation from your direct supervisor or whoever manages you. And then the professional recommendation can be just any other professional recommendation, a former supervisor, a nurse educator, someone who knows you in a different professional capacity. So in general, we are looking for quality, not name recognition, or if they're a Penn alumni. It's great if you know your dean or CNO or someone is a Penn alumni, but if they can't write a strong recommendation, then that's not going to do anything for us. Your recommendation should build upon other aspects of your application and can also emphasize strengths and weaker parts of your application. So maybe you didn't do very well in your undergraduate career, but you improved towards the end and you did really well in a class. Maybe you have that faculty member write you a letter of recommendation. And we only accept academic or professional recommendations. I'm sure your mom or grandfather or best friend could write you a really great recommendation, but that's not the point here. We only accept academic or professional recommendations. As of July 1st, the GRE is no longer required for any program. Previously, it was required based on your GPA and required for all PhD applicants, but it is not required for any program. If you are a non-native English speaker, or if your undergraduate degree was not conducted in English, you do need to submit the TOEFL or the IELTS. We don't have a preference, you just need to submit one. The minimums are on the screen and also available on our website. We require a transcript from your BSN program and all additional degrees and coursework completed. So if you have another graduate degree, if your BSN program is your second degree, we need all transcripts from those programs. We only need unofficial transcripts. We strongly encourage you to just submit your unofficial transcripts during the application process. Official transcripts are only required if you're admitted. And international transcripts must be evaluated through WES or CGFNS. These are the only two organizations that we accept transcript evaluations from. Other application items, if you are currently an RN or APRN, we need your license. Upload whatever you're issued, a scan of your physical copy, a screenshot of the online certificate, whatever you have, just upload that. If you are an international applicant and you do not have a United States license, but you're licensed to practice in another country, you need to complete the CGFNS certification program. Each program requires a statistics class, an introductory statistics class that needs to show up on your transcript. There's nothing more you need to do. If you're applying to the Postmaster's DNP and Executive Leadership DNP programs, you do need to submit a clinical verification form, which is available on the application. And then we do have an interview process, and that is by invitation only. We will reach out to you. This previous year, all of our interviews were either by phone or done virtually over Zoom. But in the past, we have been flexible. So if you're not local, you don't need to make the trip out there. We can arrange for a phone or virtual interview. Okay, student services. I'm going to briefly just touch on some of the available services. So as a Penn nursing student, you are also a University of Pennsylvania student and therefore have access to all of Penn services. So we have our own Office of Student Services, which handles everything from orientation to graduation. There's also the Office of Career Services, which is great. Some of you may not have interviewed for a job in quite a few years. So they can help with mock interviews, resume writing, cover letter writing. There's a lot of career fairs throughout the year. Counseling and psychological services. If you need a referral, if you need therapy, if you just want to talk to someone once, they have services there. The Weingarten Learning Center is fantastic. Some of you may have been out of school for a while. If you need anything from study tips to essay writing, help with, reviewing and grammar and anything that goes along with that, sometimes that goes out of your brain when you've been working for a while. They're there to help with that. And if you need any resources around student disability services, if you need accommodations, they can help you with that. Student health services offers primary care as well as sports medicine, nutrition. They offer massages, which is great. Sometimes we just need a little bit of relaxation in a stressful program. And then the Graduate Student Center puts on a lot of events throughout the year and is also a physical space when open that you can go to for studying or group meetings or things like that. And as my coworker, Janae, who is the graduate advisor, always says, there is free coffee there. So at the very least, you can go and get free coffee. Now I'll briefly touch on tuition and financial aid. I am not a financial aid counselor. We have fantastic financial aid counselors available. I am just here to give some general information. The tuition and fees for all of our programs is available on our website. Very basically, your program costs depend on how many course units you take per semester. The average course at Penn is worth 1 course unit and is equal to 4 semester hours. So there's really no difference between full-time, part-time, in-state, out-of-state. It all depends on the course units you're taking. So these are the 21-22 tuition and fees. The full-time is an estimate. This includes estimates for personal and living expenses. So this might not apply to you. You might have more expenses, you might have less expenses. So you can see a full breakdown on our website, but the full-time is just an estimate. We do have some scholarships available for our full-time students for need and merit-based awards. We have a relatively new scholarship called the Gutman Leadership Scholars Program. The president of Penn, Amy Gutman, and her husband donated $2 million of their own money to the School of Nursing last year, which is just so wonderful. And we are thrilled that she was able to do this. So there is an application prompt for our full-time MSN students. That's who it is available to right now in the application. We are also offer veteran and GI benefits through the Yellow Ribbon post 9/11 bills. If you are a Peace Corps volunteer, there is a scholarship available. And if you are a Penn Medicine or Children's Hospital of Philadelphia employee, you are eligible for a scholarship, which we like to call the buy 3, get 1 free. So after completing 3 course units at Penn Nursing in a calendar year, that's January through December, Penn Medicine and CHOP employees can receive a scholarship for the cost of tuition if they take a 4th CU in the same year. So you can take 4 classes, the 4th one will be free. And that's on top of any benefits you receive as a Penn Medicine or CHOP employee. Many of our students do need to take out loans. There are so many different loan options. There are private loans, there are federal loans. Some might work better for you than others. I encourage you to explore all opportunities. Some have more benefits, some have different benefits. So I encourage you again to explore all of these options. And there is more information on the financial aid website. There are a variety of federal loan repayment programs. So you may be familiar with the Public Service Loan Forgiveness Program, but there are specific nursing loan forgiveness options as well, where if you agree to work for a certain number of years in a certain area or organization, your federal loans are repaid. And then there are also external scholarships. We have a list on our website, but it is non-exhaustive. There are so many external scholarships out there. If you were involved in any sort of organization as an undergraduate student, you can look into your local government might offer external scholarships. You never know what you might find. I often find a lot of people won't apply to an external scholarship because it's only $500, it's only $1,000, but that can go towards a new laptop, towards rent, towards supplies. So, sometimes it's, you have a better chance because not many people are applying to them. Okay, and these are our deadlines for the upcoming year. So first I'll talk about our MSN programs. So we have deadlines for different enrollment statuses and terms. So you have one deadline for part-time spring, one for full-time, and then one for part-time summer or fall. So you do have to apply by these deadlines, but then there's a rolling decision process. So just because you and your friend apply for part-time spring by October 15th, your friend might hear back on October 25th. You might not hear back until November 25th. So there is a rolling process. So if you're applying for part-time spring 2022, you need to apply by October 15th. And the latest you'll hear back is mid-December. For full-time, summer, fall, doesn't matter. You need to apply by November 1st. Full-time summer, we'll hear back by mid-February. Full-time fall, we'll hear back by mid-March. If you're applying for part-time summer or fall, you don't need to apply until March 15th. And you will most likely will not hear until after March 15th. So you can certainly apply today or tomorrow, but you're not going to hear back for quite a while. Part-time summer, we'll hear back by late April. Part-time fall, we'll hear back by mid-May. Our nurse anesthesia program, the deadline is November 1st. And remember, we're admitting for 2023. That is more of a traditional application review process. All applicants will hear back by late April. Our postmasters and executive executive leadership DNP programs will hear back by, the deadline is November 1st. You'll hear back by mid-February. And the PhD program, the deadline is December 1st, and you'll also hear back by mid-February. And thankfully, if we have questions, because I am stumbling over myself and need to take a sip of water. So if you want to type your questions into the chat box, and I will start answering them. So our first question is, what kind of national and international opportunities do you have for the CRNA program? So in terms of national opportunities, many of our students participate in the conferences and programs for student registered nurse anesthetists, SRNAs. And there usually is a trip over spring break to Guatemala for the CRNA program. Again, that did not happen last year. Hopefully it will resume soon. So with the holistic approach, when looking at applicants for the CRNA program, applicants with less than 2 years experience at time of application are still considered. As long as you'll have 2 years of experience by the time you enroll, we will consider you. Again, the strongest applicants typically have 2 to 3 years at time of enrollment. The executive leadership DNP program starts in the fall. Can you take classes in advance? Potentially, it depends on the class you want to take. That is something you can reach out about, and we can advise you if you are admitted. Since rolling admissions is used, are there more seats available closer towards the application opening than the actual deadline? No, so we don't typically review applications until after that specific deadline. So there is one set amount of seats and it doesn't change between when we're reviewing them. How old can the statistics course be? There's no expiration date on the statistics course. How many students typically get admitted into the MSN programs? That usually varies per program. Since we guarantee you a clinical spot, we only admit for the amount of clinical spots we have. We typically admit between 10 to 20 students in each program each year. How many students are accepted full-time for the PhD program? That also depends. That depends on our funding. The largest amount in recent years we've admitted is around 15. We typically admit between 8 to 12 students. I'm currently taking a course to boost my GPA that ends after the November 1st deadline. How can I show this on my application? Will it still be considered? You can upload the your proof of enrollment into the application. You can email us when you've finished the course, but we can't guarantee that it will be we'll be able to update it. Are any of the PhD courses available online? No, the program is in person. I'm currently in the nursing school where I'm obtaining my BSN. My expected date of graduation is May 2021. I think you might mean 2022. Is there any way I could apply to the F&P program for, I think this is fall 2022. So for our primary care programs, if you'll have your BSN by the start of the MSN program, you can apply. For our acute care programs, you do need to have that work experience. What's the pass rate for the psych mental health program? The individual pass rates are on our website. It's typically between 90 and 100% for our MSN programs. For the nurse midwifery program, would I need to be on campus? Yes, all of our MSN programs are on campus. For the statistics course, is biostatistics acceptable? Yes. Do we have any bridge programs for the DNP PhD? No, at this time, we currently don't have a bridge program. I was aware UPenn ended students 2 years in advance for the CRNA program, but I was wondering why it was done this way. How come prospective students that apply in 2021 don't start in 2022? That's a great question. It would be a lot easier if we did it this way. I believe it's due to demand. It seems a lot of other schools are also admitting a few years in advance. So this is just the way it's done. Is the MSN student allowed any input on their clinical placements, even though they're organized by the school? Yes, to an extent. You will speak with your advisor about your interests and your career goals. We can't necessarily guarantee clinical placements just due to restrictions and clinical agreements and things like that. But we really do our best to make sure that your clinical placements align with your interests and your career goals. Question, can we do a dual degree with the MSN and MBA? No, we do not offer the dual degree with the MSN and the MBA. There's a question about percentages admitted for the psych program. In general, our MSN programs vary between 30 to 40% admitted. How many students are interviewed versus accepted for the CRNA program? We typically receive around 130 to 150 applications. Typically about 90 to 100 are interviewed, and we admit usually less than 30. There's a question about dual MSN programs. So I don't believe I said this in the beginning. The nurse midwifery program is a dual program. At the end, you'll be eligible to sit for the National Nurse Midwifery and Women's Health program. There is no dual programs with our other MSN programs. The only postgraduate certificates we offer are our adult acute programs and pediatric acute and neonatal acute. Another question about nurse midwifery. I'm interested in nurse midwifery as well as women's health program. I read that we can sit for both boards. How does this track differ work? So you go through the same curriculum as the women's health program. And then the reason yours is longer is that you basically take the courses and do the clinicals to learn how to deliver babies. So again, at the end, you're eligible to sit for both exams. For the MSN program, do you recommend or require additional RN licensure in New Jersey and Delaware? Yes, so by enrollment for the MSN programs and the anesthesia programs, you'll need a Pennsylvania license. You will most likely need a New Jersey and Delaware license. That's something that your program advisors will let you know once you are admitted. Do letters of recommendations need to be hand signed, or are they electronically signed? Everything is done through the application. They do not need to be hand signed. You'll register them in the application system, and they'll get an email with a form to fill out and where they can upload their recommendations. So it's all done electronically. Will a PhD graduate be able to be a principal investigator on their own research study? I assume that would depend on the research study. They might have, certain requirements about your qualifications, but I don't see why you wouldn't be able to be a PI on a research study. Do international students need to pass the NCLEX before attending your DNP anesthesia program? Yes, and you also need to have at least 2 years of work experience. Are clinical sites for the CRNA program listed anywhere on the website? I don't think so, but our clinical sites also take place in Pennsylvania, New Jersey, and Delaware, a lot at the Penn medicine systems. We do have some clinical sites in Allentown, Pennsylvania. We also have 2 sites in Maryland at Baltimore Shock Trauma and Johns Hopkins for our anesthesia program. And for those, there is a student apartment. So that is quite a commute. I may be out of country for a period of time in the spring. Are there events or obligations prior to a summer start that would require a person to be physically present? We can organize a virtual interview if you can't meet in person. Other than that, you shouldn't have to be in person for anything. Just going to answer a few more questions since we're almost at the end. Are there any special conditions for the Center for Health Outcomes and Policy Research? Can foreigners enter? I assume you might be talking about the PhD program, and if that's the case, then we international applicants are eligible for funding through that program. Are only competitive applicants offered an opportunity to interview? If not, are you no longer considered? So yes, our most competitive applicants are offered an interview. If you are not offered an interview, then you wouldn't be admitted. Regarding the nurse anesthesia program interview process, are the questions more personality-based or clinically based? A bit of both, mostly personality-based and based on your interests in the program. They might ask you questions that you should already know based on your work experience, but they're not going to be asking super specific questions that only a CRNA would know because you're not yet a CRNA. So they might ask some specific clinical questions, but it should be ones you've already known. All right, well, it is 1 o'clock. Again, if you have any additional questions, please email us at admissions@nursing.upenn.edu. This was recorded, so if you do want to listen to it again, you'll get an email in a few days. Thank you all for listening in. If you are applying this year, good luck, and we look forward to reviewing your applications. Have a great day, everyone.